Hi, this is MONOIMPLANT Advanced Surgical Kit. The kit comes with packing like this, and when you open, you will see this pack. There is a clear instruction written about the protocols for sterilization. So you must avoid dry heat sterilization and also chemical sterilization. The recommended sterilization is autoclaving, and you can see a C certification for both drills as well as for the drivers. So when you open this surgical kit, so you will notice that there is a driver and ratchet, and also you'll notice a scale on the surgical kit. This will help you to measure the drilling length in case if you require. And here you see there are three components, important components. There are lance drills and tappers, and then you have drivers. And these drills, there are, if you notice, there are 8 drills. The first one is 2 mm, and second one is 2.5 mm, 3 mm, and 3.5 mm. And also you'll notice that we have 8 drills comes with a kit. This is because the cortical or implantology, very important that your drills should be sharper, and many times you place many implants, so there are chances that the drills will wear out faster. So in order to have all the time the sharp drills, because the sharp drills are very important in order to drill this very hard cortical without much fragmentation of a cortical bone, so that will lead to a delay in healing. So these fine drills are very important, fine and sharp drills. And if you notice that there are long drills and the short drills. If you notice, there are 2 types of drills. One is a long and another one is short. These short drills are particularly useful in the posterior area, mandibular posterior region, where your patient is not able to open, and especially when you're doing a lingual cortical, and also in some areas where the mouth opening is restricted. The long one can be used in the anteriors, both upper and the lower anteriors, and the tuberopterygoid areas, which are very common, requires a longer implants. And most of the time, if you are using a 2.7 mm or a 3 mm, only single drill is sufficient using a 2 mm yellow color drill. Then we have long and the short black color drills, which is 3 mm. So if you notice this, these drills are black color drills. Again, long and short. There are 2.5 mm. If you are planning to place 3.2 or 3.7 mm, depending on the bone consistency, only one drill is sufficient. And then we have 3 mm drills, again the short and the long drills. And also we have white color short and long drills, which are 3.5 mm. So at all the time, you will have 8 drills in the kit, which is very, very useful. In case one wears out, the other one can also be used. The next most important one is a tapping drills. They are particularly useful after you drill. You must expand the bone or compress the bone with these tapping drills, because this will prepare the bone bed for your insertion of the implant. And this is particularly useful for rough surface implants. So all the rough surface implants, we have to drill them first with a lance drill, and again use the tap drill in order to prepare the bone bed and then place the implant. And here again we have about 10 tap drills, 3, 3.2, 3.7, 4.1 and 4.9. So if you're using a 4.9 rough surface implant, I suggest you to use a 4.1. And they're also useful sometimes if you miss a second cortical engagement with your implant. Please remove the implant if it is not engaged. Take the tap drills and try to insert it and feel the second cortical locking, and then place the smooth surface implant. It's also very useful. So coming to a ratchet drivers, This kit contains a very small ratchet drivers where you can see there are two types of ratchet drivers, one for a small edge and one for the large edge, because we have two types of abutment edge, one for a short and one for a smaller head and one for a larger head. Look at the size of these drivers. They are particularly useful in the posterior most areas when there is a mouth opening is difficult, or when you are not able to when you are not able to drive the implant with a ratchet. And also we have the most commonly used ones. This is next size, and then we have a longer one. Sometimes lip comes in the way when you are inserting the implant with the driver and the ratchet. So in order to avoid the lip getting injured, we can use a long drivers to insert the implant. And again you will notice there are two drivers. This is handpiece drivers. So these handpiece drivers are useful. You can place the implant, you can place this one into the handpiece and take the implant and you can use them. And this is also compatible with using with this hand driver what we have, but I suggest you do not drive the implant to the full length with this one, because the high torque will lock these two and this will never open up. This is very important when you're using this surgical. Do not use probably 2 or 3 threads. You can take the implant with this and just place it, and please remove this. You cannot do it. And this driver is particularly useful if you want to tap sometime tuberopterygoid area. You can make it as a tapper. So this is also useful to use this. And you will also notice there is a small hole here. This small hole is also present everywhere. So sometime when the friction grip, the implant is firmly stuck with this driver, you can use this hole, probe or something, probe or explorer, and then just push it like this. This driver will separate. This is a one way. Or this driver can also be separated by just simply tapping this driver from the implant abutment. This will come out. This is another way of removing these drivers. So, and you will notice that there are 2 of them are left empty. These are particularly later when we have a 2-piece implants. This will be, the drivers will be given along with the kit. So in addition to that, our kit contains 2 additional drivers. They are called hand drivers. They come with a large head against small head. These drivers is used for placing the implant directly with a hand. You can take an implant and then you can place them directly into this into the jaw, bone breath preparation. So totally, these usually not a part of the surgical kit, but they come additionally for this. So totally you will have 3 hand drivers and 1 ratchet, and these are the components. So this advanced kit is useful not only for the beginner in the corticoimplantology, but even an expert, sometimes they require these tools. So this is the complete mono implant surgical, advanced surgical kit.